Hello, Jack Mackinson here. What I'd like to show you is some items that I use for what they call an IFAK, which is an individual first aid kit, and the components and materials that I put into it. And I'm going to show you a list of what I have in it. The first thing I have is what they call a Condor tactical bag or Black Hawk medic roll, which I use to keep all my medications and supplies. The next thing is a tourniquet. It can be a CAT, or you can get one from S&S Precision. The next thing I have is EMT shears to cut away clothing to get to a wound. I have 2 grams of Celox, which is for small wounds like on your finger. It's this hemostatic agent that helps clot blood flow and stop it from bleeding. The next item is called Tegaderm. They use this for normally when they put an IV in, and it's a bandage that they put over that. It's clear and it sticks pretty good. The next thing is called Stingies, and it's for bee stings and things like that, and it takes the burning away and things of that nature. The next one is called Quick Clot Gauze. Now, these are bigger pads than the regular Celox that's granules, and it is used for larger wounds, and you pack it into the wound, and it will promote clotting. The next one is called an Israel bandage. There's 4-inch and 6-inch. Now these are compression bandages, which have a gauze pad on the roll, and what it does is it allows you to compress a wound with a special compression bar that's across that. The next one is a portable eye wash, and that's for, of course, cleaning out eyes that have maybe a piece of a particle or insect or things like that. The next item is gauze pads. Now I keep 4x4s, 3x3s, and 2x2s, and they're used to cover wounds. The next item is I have both alcohol and betadine swabs for disinfecting wounds and things like that. The next thing is assorted band-aids. Now I like the fabric type, but these are assorted, which is small, large, knuckles, and things like that. The next item is tweezers. I have both pointed and angled for splinters and things like that. The next thing I have is Benadryl capsules. Now these are good for if you have allergies or if you're going to anaphylactic shock. 3 tablets is like compared to 3 capsules are compared to slow-acting EpiPen. The next item is called ABD pads. Now these are abdominal bandage pads, and they're 5x9. They're used to pack large rooms. The next thing is nitrile gloves. They're latex-free gloves, and I use that. I put them on immediately before I touch an individual that's been hurt. Next item is 3M Transport tape. Now this is breathable tape, and it adheres very well, but it allows it to breathe. Next item is Ace bandage, which is 3-inch. It's used for sprains, mostly on ankles and things like that. The next one is called Adaptic gauze pads. Now these are pads that won't stick to the wound like normal gauze pads. It's kind of like what they call non-adhering gauze pads. The next thing I have is smelling salts. It's compared to ammonia salts, and it's used to bring somebody conscious from fainting or things like that. The next thing I have is called an EpiPen. Now, this is for people in anaphylactic shock, and it's basically adrenaline, and it takes them out of the shock. The next item is a CPR mask, and it's used for CPR on individuals that you are not familiar with or strangers that might have contracted any disease or things like that. The next item is Curlex. Now, this is a special gauze, and you use that to wrap around a wound with already a gauze pad in place, and it sticks pretty good and works well. The next item is just a basic pain reliever. It's called Tylenol, and you all know what that is. I also carry a chapstick for obvious reason. The next item is burn spray, and it helps when you have a burn to take the pain away and help promote healing. The last item is antibiotic ointment. I put that on small wounds to prevent infection from bacteria and things of that nature. So that's about it, and I want to thank you for watching, and I'll have other videos concerning trauma and first aid kits. Thank you.